guys, welcome to another episode of Trauma Pond HQ. My name's Olivia, and this is where we sit by the pond and have a little chat. So, what we're going to talk about today is something that I am very concerned about, only because as someone who has ADHD, an ADHD diagnosis is not something that is to be taken too lightly, especially with the fact that there are very harsh medications involved. And unfortunately, the BBC for Panorama was able to do an expose on private ADHD clinics and exposing the psychiatric profession for misdiagnosing, which is really disturbing. And in all honesty, we really need to go through this point by point. I can share my experience of this, but before we go any further, if this is something that interests you and you're enjoying the episodes, please like, subscribe, and leave a comment, tell me off, do whatever you want. It's not going to affect me. I've had enough trauma, so. But everything that we're going to talk about here, this is purely for entertainment purposes only. Please seek medical advice should any of this actually affect you. The only thing is that we're actually going to expose the wrong people here. So yeah, drop me a DM. Let's see if we can figure something out. So pretty much there is a journalist who has gone undercover to get diagnosis from quite a few different private practices in the UK. And it turns out that the NHS has got a 5-year wait for people to go and get diagnosed with ADHD. That's a really long time. And you know, that's no shocker for the ADHD system. There is a very long wait for anything in that. And honestly, I have watched most of this. I haven't watched all of this, but I thought what I haven't seen would be a good blind reaction. The amount of money that people pay to go and get a diagnosis privately is insane. It's genuinely mind-blowing. And in all honesty, I'm pretty angry. I'm angry for people that have gone through this. So let's have a little look at what they have found. And let's try and understand what the hell is going on. Because if there is one thing that I have said multiple times, no profession is free from narcissistic people, including psychiatrists, doctors, surgeons, all of them within the field, even psychologists. So unfortunately, as someone who wants to be a psychologist, I do not want to be someone that is painted with a bad brush from bad psychologists. So let's have a little look at what is in this episode.
How much was it?
It was £695, and she was given a private prescription, which cost £100 a month. It only took about half an hour.
So they assessed her, diagnosed her with ADHD and prescribed her medication in around about 30 to 40 minutes.
That's correct.
Okay, so that was a mum talking about her 21-year-old daughter getting a diagnosis from a private psychiatrist, 30 minutes is not enough. I don't know what the protocol is per state, but I know that in South Australia, you need to have a minimum of 2 hours with a psychiatrist to get a diagnosis. Psychologists cannot diagnose ADHD. So you have to get it done by a psychiatrist. Psychologists can refer for you, but they can't diagnose because psychologists are not licensed to prescribe medication. And it is something that requires someone that has gone through med school, and psychologists have not gone through med school. So that is an obscene amount of money. 30 minutes, not enough. I'll just say from my own experience, when I was getting diagnosed, I went to my doctor. I said, I have concerns that I could potentially have ADHD. It is not cheap to go and get an ADHD diagnosis privately. in Australia. The one I had to pay for, the total, because I had to have two separate meetings with a psychiatrist, it was over $1,200 to get that diagnosis. And you have to do a very thorough check of your past histories. They even talk about your birth. So it's not a 30-minute you can't diagnose someone within 30 minutes. Even I can't tell if I'm in the presence of another ADHD person in 30 minutes. Usually it takes me 40 minutes. And it is quite funny when I do meet another person, because ADHD people mask. And if I meet another person who has ADHD, I can tell like from little tiny slip ups as to whether or not they have ADHD. And then once they take their mask down and I take my mask down, it's like watching two pinball machines going at it. That's kind of like what a conversation is like with an ADHD person. So it's almost like a car crash watching people with ADHD have a conversation. You want to turn away, but you also want to look at the same time. Actually, I don't even think people want to look. It's too much.
Many are taking online surveys to see if they might have the condition. So I try one. I find it difficult finishing a task or project. Sometimes. I find it difficult to sit still and often fidget or squirm very often. I can't sit still. And here's the results. Your results are highly consistent with ADHD.
Okay, there's a problem with these online assessments. So with these online assessments, I really hate the ones that say, yeah, you most likely have it, or things like that, because then it gives you the idea that you potentially are self-diagnosing. That's not how this is supposed to work. Everything is Dr. Google these days, and in all honesty, why wouldn't we turn to Dr. Google? Because the problem we have is that now we're finding that we can't trust doctors. This is a very unfortunate thing that's definitely come, especially over the last 3 years. So the issue that I'm having with these online assessments is you are going to think that you potentially could have ADHD, you potentially might have autism, or you could have borderline personality disorder or bipolar disorder. All of those things coexist with the symptoms. And if you are a person who has borderline personality disorder, or actually, if you have bipolar disorder, and then you get diagnosed with ADHD and you're taking ADHD medication for bipolar disorder, you're going to get severely ill, and vice versa. The symptoms will get worse and you will develop more symptoms from the type of medication that you're going to get. So it's incredibly harmful to get a misdiagnosis. So these online things, do not take them for like for gold. It's not worth it.
I want to know how ADHD assessments should be carried out. So I've come to see an NHS consultant psychiatrist who runs a specialist clinic.
You've come today to find out a bit more about whether you may or may not have ADHD, is that right?
Yeah.
So what we're going to do, we're going to talk about not just ADHD. I need to get a broad picture of your psychiatric health, of your background, understand a bit more about you as a person.
The assessment feels like a full mental health MOT.
How was it for you sitting through a class?
I'd always be moving, so like my foot. So I am quite fidgety, so my leg does bounce up and down quite a bit. It lasts more than 3 hours and covers almost every aspect of my life.
I would tell you at this stage that you don't have a diagnosis of ADHD.
Dr. Smith says I don't meet the clinical threshold for ADHD in any of the 18 symptoms.
Okay. 3.5 hours, that's very extensive, and that's pretty standard. Like I said, mine was 2.5 hours. Yeah, 2.5 hours. with the psychiatrist, and the minimum requirement in South Australia is a 2-hour assessment. I was 2.5 hours, and I was diagnosed with inattentive ADHD. 3.5 hours, because he wasn't seeing any signs at all, he would have gone further. So he probably would have been looking at so many other potential diagnoses through that assessment, because you can't just go in with the idea that someone is saying that they want to have an ADHD diagnosis. They have to be completely like non-bias towards your thought or the opinions of the GP. They have to go from a blank sheet. They can't go off the idea that there's just the idea that there's ADHD. They have to look at other ideas in their assessment. And in all honesty, when I was going and getting my second assessment, because I had 2 sessions, I was terrified. I was really terrified. I knew that the second session was going to be the one that I was going to get diagnosed. And I was worried that I was going to be diagnosed with bipolar or potentially borderline personality, or even, I wasn't worried about autism. My partner's autistic, and we are very, very different, although we have a lot of similar traits because autism and ADHD do overlap. But I'm hypersensitive to emotion, and he's not. So I didn't worry about the fact that it would have been autism, but I did think that maybe there was a potential of being borderline or bipolar. It's because it's B's. It's the 2 B's. It's the dyslexia. That's the other problem. All right. So 3.5 hours, that is a good assessment.
One clinic keeps coming up. Harley Psychiatrist in Harley Street, London. I'm going undercover as a patient to see what goes on during an assessment. I'm using my middle name James. I've paid Harley £685 for an ADHD assessment. After filling out a series of questionnaires, I have an online appointment.
All right, well, let's get you assessed and see where we can go from there.
Okay. Despite the company's name, the assessor isn't a psychiatrist. Olga Pahulets is a psychologist.
Do you recall being quite a disorganized child? So, for instance, having a messy bedroom, things like that?
My mum would definitely say yes. She runs through a checklist of questions about symptoms.
Would you say that waiting was difficult? Like when you'd have to wait in a queue?
Maybe sometimes if the queue was really long. I answer them all honestly.
Would you say that you still become distracted or even just bored by things quite quickly?
I can get bored by things, certainly the more mundane things. But there aren't any detailed follow-up questions.
Okay, I'm just gonna... The first time I watched this, I thought it was... everything was wrong here. Like, every single thing was wrong here. First of all, a psychologist cannot diagnose ADHD. Not allowed to happen. What is supposed to happen is a psychologist can say, I am indicating that you have got traits and I would like you to go for an assessment with a psychiatrist so that we can see if you have got ADHD. That's how it's supposed to go, okay? Waiting in queues, that is not a problem with ADHD. That's a problem for everyone, okay? Everybody does not like waiting in line. That's a really stupid analogy. I mean, if it's supposed to be, do you have problems with patience? Like, can you have, do you get under, see, like, look, my ADHD is kicked in and now I'm shutting down. And now I'm getting bored with myself. See, that's what it is. Psychologists are supposed to present themselves as professionals. They are not supposed to present themselves as grungy. You are a working professional. You did not go to university for 6 years, potentially 6 years, maybe 4, depending on that. But you have to go through an extensive amount of training and get copious amount of hours to get licensed as a psychologist. And she is uninterested. She has no care whatsoever, laissez-faire attitude. This is the type of person that does not need to ever be a psychologist. I'll say that right now. There are a lot of people that should not be psychologists. 100%. And even I am really struggling with the idea of going forward in psychology, because the way the system is built, I'm really struggling with it on a moral level. I see way too many discrepancies with the academic side opposing that side that has genuine care. Because the amount of people that go in solely for the accreditations, the titles, the idea that you will have an upper hand because psychologists know certain workings of the mind, and that gives another element of control. Like, as psychologists go, we even have to learn the power of ethics, and you can get done pretty badly if you go against those ethic codes, especially knowing that you can use your knowledge to manipulate. Like, that's why this is scary. I'm not gonna lie, this is like, everything about this psychologist is terrifying, because she has such a bad attitude and is portraying herself in a very bad way. So I have a lot of issues here.
Would you say that these days you can be quite loud spoken?
So, not loud spoken. So, I've changed that. You know, if I'm out and about.
Sure, but I'll put it down as a symptom just because it requires effort. Okay, is there anything I haven't asked you about that you feel like I should know?
Sure. But I'll put it down as a symptom because it requires effort. That's not what you put. You don't even say that. Why would you even speak those words? That's not okay. Like, you're not actually listening to what the client has said. You're saying things like, okay, I have to tick boxes here. You've just said something that ticks the box, and I'm going to run with that instead. That's just wrong on every level. And the thing is, she is not intelligent enough to know that she's not getting good commissions from the pharmaceutical level here. The doctor gets the commissions from the pharmaceutical level. Oh yeah, that's how it works.
Obviously, I've watched all the videos on social media.
Sure.
The meeting has just ended.
I wouldn't be surprised if she actually ended that because he said, I've been seeing things on social media.
Sorry, I must have been rabbiting on too long.
Well, I could keep asking you more questions, but I don't think I'm going to change my mind. So I think you fit the criteria for ADHD very well.
So what does that mean now? So what does that mean then?
You'll have it in writing officially that you've been diagnosed.
Okay.
And there's no expiration date for this, so you are diagnosed for life.
Okay. Well, lovely to meet you.
Okay, here's another thing as well. When I was getting diagnosed with ADHD, even though I went in knowing the likelihood of me being diagnosed with this particular disorder, even though I knew it was very, very possible, when I was told I had it, I was distraught. I was very upset with learning that my entire life made sense from a neurological disorder that I've had my entire life that was hindering me so much. It's really upsetting. It's actually really upsetting to get that diagnosis. I mean, I'm sure it's not the same for everyone, but for a lot of people it can be. And I know I'm not the only one. I've spoken with quite a few different people who have been told the same thing, and they have all said that they were very upset when they were given the diagnosis. She doesn't actually say you have a diagnosis. She says you're indicating these signs. So technically, she's not diagnosing him. She's just saying that you have traits of ADHD. Okay, that's absolutely fine. But the write-up and everything, like, this is a permanent record thing in a lot of cases. So a lot of people don't handle it the way he is handling it, but that's also because he's also had an assessment with a psychiatrist already that was 3 hours, and he knows he doesn't have ADHD. So, okay. So now what we're going to do is we're going to jump to the next part of the process with this Harley psychiatrist. So pretty much what is going on here is this is his meeting with the psychiatrist.
I've now received the psychologist's report. But to get a prescription, I'm told I need to talk to a Harley psychiatrist. Dr. Mohan Rathnaya.
Can you hear me?
Hello, doctor. Hello, I can hear
Hi.
you.
So you already been made known of the diagnosis, yeah, from our clinic.
That's the first thing he says, is you've been made aware of the diagnosis. He hasn't technically been given a diagnosis. He's been given an indicator. So, and like I said before, a psychologist cannot diagnose ADHD. They can give indicators and refer you to a psychiatrist. So, major red flag that this psychiatrist is saying you've been given a diagnosis. This is his first assessment with the psychiatrist for this particular company. So, major red flag.
Harley's lawyers later told us it's the clinic's psychiatrists who make the diagnosis. But after just 3 minutes, Dr. Rathnaya is already suggesting ADHD drugs.
Have you thought about the medication?
What do you think would work?
So yeah, if you ask for my recommendation, I would say let's start with Concerta XL.
Okay.
See if it helps you. And then increase the dose.
Okay. Wow. 3 minutes in, and the psychiatrist has not assessed the patient. So what is supposed to happen is that, or what should be happening within this clinic, is the psychologist can do an assessment to say, do you have certain traits, all of that sort of thing. But they would also be wanting to do a background just to say, do you have potential depression or anxiety disorders or anything else along those lines? Like, because they do not they are symptoms of ADHD, but ADHD is a completely different disorder from anxiety and depression. But people will misconstrue those massively, especially when you have ADHD paralysis. So what should be happening is that if this client was supposed to have had potential ADHD, according to the psychologist, the psychiatrist would then start doing the assessment, which should in turn be a minimum of 2 hours. I'm guessing in the UK, I don't know what the legalities actually are. It clearly shows that they don't have legalities over there if people are getting diagnosed within half an hour. But it should take quite a bit of time, not 3 minutes.
He's prescribing a powerful stimulant. It's a standard ADHD treatment, which is safe and effective if properly prescribed.
The common side effects can be like a bit of nausea, headache in the beginning, couple of days, and then it settles down. Yeah, so have some food that would help in the breakfast before the tablet. Yeah, you need to keep an eye on the BP and pulse because they're just the guidelines. Yeah.
Okay. But the psychiatrist doesn't tell me that the drugs can have much more serious side effects than that. And he doesn't ask me if I'm suffering from any other mental health conditions.
Okay. This is horrific. The reason why this is so horrific is because ADHD medication is extremely harsh. For lack of a better term, ADHD medication is ketamine. All right? Amphetamine, I'll tell you the very first time that I took ADHD medication, I was put on stimulant medication straight away because I have inattentive ADHD. I fell asleep within the first 30 minutes of taking it. If you don't have ADHD and you take stimulant medication, that is the last thing that's going to happen. You're going to be bouncing off the walls. It's like what happens when you see people take, I don't want to say, but crystal. Not to the same extent, obviously, but there's a lot of side effects that come with this. And people with ADHD, they take this medication and it does slow everything down for them. If you don't have it, everything speeds up. I describe having ADHD like my brain is a pinball machine, and all the ADHD medication actually does is just slow down the pinball. So I'm very unimpressed by this process. That is terrifying. And the fact that he is straight away going to give a stimulant medication to a person who has not been diagnosed. That's what's terrifying about this. There has not been a diagnosis, and he's being given stimulant medication.
Before my appointment, me and my mum have to fill in questionnaires. The NICE guidelines say assessments must be conducted by a psychiatrist or a suitably qualified clinician. At ADHD Direct, I'm assessed by 2 nurses. Hiya, how's it going? One of them's new, so she's being supervised by a colleague. The online assessment costs £1,095. Nice to meet you. Nice to meet you.
I'm sorry, this is the parts that I haven't seen. £1,099 for an assessment by 2 nurses, not even psychiatrists, 2 nurses. That is disgusting. No. Look, I'm not discrediting nurses at all. I am not discrediting nurses at all. I have a very high opinion of nurses, to a certain degree, but the majority of nurses who I know are actually fantastic, really, really good. And of course, I have been in and out of hospital most of my life. The nurses are the ones that cared, and it was the doctors that I have massive issue with. Nurses do not have the same training as psychiatrists or neurologists. And a neurologist would have a better standing of understanding ADHD. You can actually do what's called a CAP scan and see the inactivity in an ADHD person's brain. That would be a much better way of understanding if a person has ADHD or not. And personally, I would much prefer that method to be taken seriously. I don't know why it's not, because clearly that would be much more effective. But nurses do not have the same accreditations to perform ADHD assessments. And on top of that, I'm seeing now that all of these are done online through Zoom meetings. You can really tell who has ADHD when you're in person, because the body language and everything, you can only see me from here. You can't see the rest of me. And yes, ADHD people do fidget an awful lot, even though I'm doing it right now. But even though ADHD people do fidget, we move our bodies differently from other people who just fidget. Like, he has said that he's a fidgeter, but he doesn't have ADHD. It's a different style. Like, it's not like I'm just fiddling a pen or clicking a pen like that. We do that, but there's other things that we do because we get sick of that too. Like, our brains get bored of the fidget that we're doing at that time and we'll swap to another fidget. And a good psychiatrist will be able to see that in person.
Have you got any health problems? Any?
And the assessment is longer, an hour and 40 minutes. But again, it feels like a tick box exercise.
What kind of things do you avoid at work?
I would avoid really anything that is boring. And there's little attempt to find out how seriously the symptoms affect my life.
Hi, James.
Hiya, how's it going? 3 weeks later, I get another ADHD diagnosis.
You scored 8 symptoms for inattention.
Okay.
And 6 symptoms for hyperactivity and impulsivity. So that means that you meet the criteria for ADHD combined type.
Okay. So there are 3 different types of ADHD, and they are impulsive, inattentive, and combined. Now, the fact that they're saying that he has ticked so many multiple boxes, and they were nurses, and then of course he had a full in-person assessment, which was 3 hours long with a psychiatrist at the beginning of this filming. And he said he didn't meet any criteria whatsoever, goes to show the amount of extension that has to go into these tests. Being box ticking is not how you assess people's disorders. You really have to delve in. You have to go in deep to understand what exactly certain things are, because you have to be able to read in between the lines. This is the biggest component of this. We have to analyze everything that is happening on a daily basis and how often things are happening in that day with certain traits and disorders. Just as an example, traits are patterns of behavior. So if you have certain things that you do throughout the entire day that are hindering your life, like having ADHD, being completely forgetful, but not to the extent of, oh, I just forgot 1 or 2 things. You forget everything throughout the day, and then you can't even recall the next day. Pretty much your life is like Finding Dory. Imagine having that kind of a brain, but then you can recall things from 20 years ago, point by point, even down to the very shoes that you were wearing. That's not helpful whenever you're trying to figure out, did you do the right things for work that day? Or did you do things that, even reminding yourself to eat is a big challenge. Just saying that, do you have these particular things that happen through a day? Like, how often would you say that you forget? When you say, when these tests are done, from the sounds of it, how these tests are done, they actually analyze if you have ticked a box, not the severity of these conditions on a daily life. And on top of that, what about history of mental health? Because I will tell you this right now, my list is huge. I have ADHD, I've had body dysmorphia, and it was severe body dysmorphia. I used to spend hours in front of a mirror analyzing every single part of my face. That was for years that I did that. Nobody had any idea because I just locked myself in my room. And at one point, I tried to file my teeth and break my own nose. And I'm not exaggerating this. I actually got a nail file and started filing my teeth. Yeah, I was very healthy as a child.
And once again, I'm advised to take stimulants. Lawyers for ADHD Direct say there would have been more checks before I got the drugs. They say my assessment included a full developmental and psychiatric history, and the clinic stands by its diagnosis. They say ADHD is under-identified, underdiagnosed, and undertreated. The clinic has no incentive to overdiagnose, and an audit showed 10% of the patients seen did not have ADHD.
10% of the patients did not have ADHD. That's not a good figure. Apparently, they say that ADHD is in the 5%. So 5% of people will have ADHD. A lot of people will not have ADHD, but all the symptoms that correlate with it could be, like I said, autism, borderline personality disorder, bipolar disorder, anxiety disorders, depression. It could be a wide spectrum of things that they could potentially have that is not ADHD. 10% is way too low for them to have a massive amount of people come in to see what is actually wrong with them, and they're getting diagnosed. 90% of their patients are going in and getting diagnosed with ADHD. That's not happening. I can tell you this right now. Most of their clients do not have ADHD. That's way, way, way off spec. So I really hope that they're getting investigated.
Clinic where the NHS pays for patients to be assessed. ADHD 360 is based in Lincolnshire. Patients and former staff told us appointments are short and almost everyone gets diagnosed with the condition.
I'd be given a list of 6 patients per day, and they would come on the hour every hour. I didn't feel comfortable with that at all. Bum, 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 bum.
Did you think it was safe?
Absolutely not, no.
ADHD 360 says clinicians are only expected to do 2 assessments a day. My online assessor is a pharmacist.
A pharmacist? Why is a pharmacist doing an ADHD evaluation? Pharmacists can't do psychological evaluations. It's not even the same field. Like they don't study anything to do with that. Pharmacy, psychology and psychiatry are completely different fields. Why is a pharmacist conducting an assessment?
Within a minute, Shehzad Malik says he thinks I've probably got ADHD.
A minute? 1 minute? He's got an idea that this guy had... No. Are you kidding me? 1 minute? 1 minute and he's diagnosing the guy with ADHD. Are you kidding me? That's sick. That's disgusting. You can't do that. And you can't do it if you're a freaking pharmacist who doesn't know anything about neurodivergence. Because they don't study this. Not to the extent of what they're supposed to. And then he is telling a person who potentially has depression to take stimulant medication. Can you imagine what that would do? That could potentially kill someone. That could very likely kill someone. So here's hoping he gets written up. Lose your license, that's what you need. Oh yeah, I'm that aggressive. Yeah. Yeah.
Before we begin, you would have filled out a questionnaire online beforehand on the portal.
Yes.
That kind of shows that you are likely to have ADHD.
The assessment lasts 75 minutes, and that includes 5 minutes talking about football.
Okay, 5 minutes talking about football in an ADHD assessment. Maybe he has ADHD. See how easy it is to just turn around and say, yeah, you have ADHD?
Because you don't have a proper striker.
No.
You've got there, what's his name?
Bamford. The NICE guidelines say you should take a full psychiatric history. But that doesn't happen.
I can say, across the board, you do have ADHD.
Okay.
You have a lot of the symptoms for both inattention and hyperactivity and impulsivity.
I'm prescribed stimulant medication without making all the proper checks. ADHD 360 charged me £950. That includes follow-up phone calls, but doesn't include £89 a month for the prescription.
So what's that?
I've seen enough. Okay, that's really scary. ADHD is not a fun thing to have. And it's genuinely terrifying that there are things out there diagnosing people and saying, yeah, this is what you have. It's just wrong on every level. And in all honesty, yeah, I'm really sad for the people that end up forking out an awful lot of money, because that is not cheap. I mean, the prices range between 600 to 1,100 pounds. And that in itself is disgusting. The fact that they don't even get to meet psychiatrists. And psychiatrists are the ones that are supposed to make these diagnoses. Yeah, okay, they say that also licensed professionals, licensed clinicians can do the same thing and diagnose, but a pharmacist is not someone that can make a diagnosis. Nurses are not ones that can make a diagnosis. Nurses aren't even allowed to diagnose people of a freaking cold. So why are they allowed to diagnose someone with ADHD? Are you kidding me? And 3 minutes with a psychiatrist to get an evaluation is pretty sick and twisted. Very sick and twisted. We are allowed to question things. And in all honesty, if any of you have been affected by any of those particular clinicians, I would highly recommend going and getting legal action, because they have definitely caused major discrepancies, and I wouldn't be surprised that they've caused major harm to a lot of people by giving them a false diagnosis and then giving them drugs for that false diagnosis. It's not on. And yeah, we need to learn to protect ourselves against these things. However, I did get a bit of a telling off from social media for saying that once upon a time. But let's see how this one goes. All right, guys. If you liked, please subscribe. Please like, please leave a comment. It really helps. And I'll see you next time. Toodles.